Thanks for the introduction, Rob. I'm very excited to be sharing some of the results from our study looking at suicide following self-harm in young people in Northern Ireland. And this is actually the first whole population study on self-harm and suicide in young people in the UK. And in keeping with the main focus of today's conference, this has really only been made possible by taking advantage of routinely collected healthcare and administrative data. So why is this research even necessary? Well, after road traffic accidents, suicide is the second leading cause of death in young people. Sadly, around 750 young people lose their lives to suicide across the UK and Ireland every year. And self-harm is the single most important predictor of future suicide. And although we know that it's most prevalent in young people, there's a severe lack of research examining the impact of self-harm on subsequent suicide risk and the factors that place young people at the greatest risk of suicide following an episode of self-harm. And of course, in order to develop effective strategies to reduce rates of both self-harm and suicide, we need to be able to identify and target those at the greatest risk. So the aims of this study were to firstly try and characterise young people who self-harm in Northern Ireland, to estimate the risk of suicide following an episode of self-harm, and finally to try and identify some of the factors which influence risk of suicide following self-harm. So this project used GP registration data as the population spine. So it includes everyone registered with a GP who was under 24 years of age in 2015. And to this we link data from the Northern Ireland Registry of Self-Harm and Suicidal Ideation. For those of you who don't know, that's a national database containing information on all presentations made to the 12 emergency departments in Northern Ireland for either self-harm or suicidal ideation. And it's actually the only registry of its kind in existence. So we use data on all presentations, all self-harm presentations that occurred between 2012 and 2015. We also had death records up until the end of 2018, which allowed us to follow each young person for up to 6 years. And this was supplemented by some additional area level information like urbanicity and deprivation. So our final research cohort consisted of almost 400,000 young people, 4,450 of whom presented with self-harm. And during follow-up, almost 700 young people died, and around 200 of these were a result of suicide, which means that a quarter of all deaths in the whole population of young people in Northern Ireland were due to suicide. And perhaps even more importantly, a quarter of those who died by suicide had previously presented to the emergency department with self-harm, which means that in the drive to reduce suicide rates, this is an important target population for interventions. So the first thing we wanted to try and do was to characterise young people who self-harm. And the results really confirm the trends we've seen among the general population. You can see that the odds of self-harm were highest in those aged over 18, in females, in those living in the most deprived areas, and in those living in urban areas. And in a survival analysis, we found that those who presented with self-harm were much more likely to die by suicide. In fact, their risk of suicide was increased 24-fold compared to the rest of their peers in the population who didn't self-harm. So suicide was by far the most common cause of death among self-harmers, accounting for around 60% of deaths. And as expected, the incidence of suicide among hospital presenting self-harmers was very high at 272 per 100,000 people per year. And although the incidence of suicide was highest in the first 12 months following self-harm, that risk remained very high even years after the first presentation. So we then took our group of self-harmers and looked to see whether certain characteristics influenced the risk of suicide following self-harm. And as expected, gender was one of the primary risk factors for suicide following self-harm. Males were twice as likely to die by suicide following self-harm compared to females. And there was some evidence that older individuals and those living in urban areas were also at an increased risk of suicide following self-harm, but that difference wasn't statistically significant. And in line with what we've seen in previous literature, repeat presenters were at a significantly increased risk of suicide, as were those who used more violent methods of self-harm, In both cases, their risk was more than double their respective reference group. So the findings of the study confirm that young people who present to emergency departments with self-harm are at a significantly increased risk of suicide. We observed a massive 24-fold increase in their risk of suicide compared to the general population. And although only 1.3% of all self-harmers died by suicide during the study period, these individuals represent over a quarter of all suicide deaths recorded in the whole population of young people in Northern Ireland during this time. In terms of identifying those most at risk of suicide, these findings suggest that males, repeat presenters, and those who use more violent methods of self-harm are at the greatest risk of suicide following self-harm. So this is the first whole population study of self-harm and suicide in young people in the UK. First and foremost, these findings confirm the importance of tackling self-harm in suicide prevention, but they also suggest some potential for interventions in the emergency department. And at the moment, I'm actually doing a bit more work to look at the impact of the ED care process on suicide risk. And it does appear that certain interventions reduce the risk of suicide following hospital presenting self-harm. Hopefully I'll be able to share some of those findings with you in the near future. Just to finish up, I'd like to acknowledge the rest of the research team, as well as the staff at the Honest Broker Service for making this research possible. That's all from me.
Thank you very much indeed. Lizzie Kirkham sort of pointed out, I think it's more a point or possibly a question as well, but there's the sort of paradox of self-harm being higher in suicide, self-harm being higher in females, but suicide higher in males. Does your data suggest that males who self-harm, particularly high-risk group, which I think you showed?
Yeah. Mm-hmm.
I guess there's a kind of question of obviously why, because I think that's been, or that's been shown elsewhere as well. Are you able to look at, for example, the method of ultimate suicide? Is it that men or males tend to then opt for something that's more fatal as a self-harm method when they do end up ending their lives, or those that do?
Yeah, absolutely. Well, we know from previous literature that females are actually more likely to attempt suicide. They just tend to use less violent methods, which are less successful. I think it would be possible to look at the method of self-harm, but because we have such a small sample size, I'm not sure whether we have the power to actually stratify that by gender as well as the method of ultimate suicide.